Judges ready? Opponents ready? My time starts now. We stand pro on the resolution. Public health service should expand access to gene editing technology. We'll start with definition. According to Merriam-Webster, gene editing is the use of biotechnological techniques to make changes to specific DNA sequences in the genome of a living organism. Framework. If pro succeeds to convince the judge that gene editing technologies can offer an access to accelerating further evolution and are worth expanding, which should be beneficial to all the residents of this planet, pro wins the debate. Contention 1. Claim. GET is beneficial, developing, and feasible. Support. It corrects the genetic errors that cause diseases. With over 10,000 diseases caused by mutations of a single human gene, CRISPR offers hope to cure them by repairing genetic errors the patients have. According to LA Biotech, several biotechs are already working hard to make it happen. Scientists at the Oregon Health and Science University used CRISPR to delete some defective genes in several human embryos, and the results were promising. This has been a big progress, and as time goes on, development of technology will get rid of the errors. A lead author at OHSU also mentioned that by using this technique, it's possible to reduce the burden of the heritable diseases on the family and eventually the human population. Evidence. Companies have already been approved for real-life clinical trials. On November 30th, the FDA approved Editas Medicine's investigational new drug for clinical studies evaluating genome editing candidate EDIT-101 for the potential treatment of LCA10, a group of inherited retinal disorders that cause childhood blindness. According to the company's newest press release, EDIT-101 is expected to become the first CRISPR therapy applied by humans. Impact. Gene editing technologies have given the people suffering from diseases a choice. Public health services should care about people's health, and GET is the best solution because it is beneficial. Also, it's more acceptable than other alternative ways. Contention 2. Claim. It is better for public health services to get access to them. Support. As soon as gene editing is convincible enough for people to take it, they'll choose the higher quality ones. If public services do not open access to it, private services will take over. The market climate changes along with people's requirements, and once several private services have a monopoly on this technology, they'll raise the price to a level most beneficial for them. This is the time when inequality happens. Only the rich can afford it. The circumstance of all the residents is held in companies who have a goal as earning fortune. Public services expanding technologies will effectively prevent this problem. While the public services take in charge, they will have much lower costs for the allowance government pays. This promotes the spread of gene editing technologies, benefits nationwide, and reduces risk. The public services will be ensured to have the most secure services and the highest qualities. Impact. Public health services always have responsibility, and they care about the public's health, so they only choose the ways that can benefit everybody the most. Private companies might have more advanced technology, but they'll monopoly this technology, raise the price, creating inequality at the same time. Contention 3. Claim. People with rare genetic diseases should not be ignored. Support. Each rare disease only affects less than 1% of the world's population, but there are over 7,000 rare diseases in the world, like childhood acute lymphoblastic leukemia and congenital muscular dystrophy. Private health services will sell the drugs for the diseases at very high price to make profit. But if public health services expand access to gene editing because they're responsible for the citizens, they will try their best to develop the technology so that people with rare genetic diseases can be treated properly. They deserve a chance to be cured of their diseases. There is medical service for rare diseases. Why shouldn't there be a public health service for gene editing? And from the contentions above, Pro offered abundant evidence about how gene editing technologies will influence mankind in a positive way. Also, we proved that gene editing technology spread by public services opening the access will accelerate our evolution and is the most effective way nowadays for us to suffer less. For these reasons, Pro shall win this debate.